Good morning and good afternoon, depending on where you're joining us from. Welcome to Building State and Local Partnerships to Support Familiar Faces. As folks are getting situated, we would love to have you introduce yourself in the chat. So you'll see on the slide a prompt for your name, location, and what you're hoping to get out of today's webinar. What brings you here today and what are you hoping to learn? So thank you so much for joining us, and get yourself comfortable. We're really looking forward to a great conversation. Good morning and good afternoon, depending on where you're joining us from. Welcome to the Building State and Local Partnerships to Support Familiar Faces webinar. As folks are getting situated, we're just asking you to please introduce yourself in the chat, include your name and location, and we will be very grateful if you include what you're hoping to get out of today's webinar, so we can align our comments appropriately. Thank you so much. All righty, let's get started. It is 2 o'clock Eastern time, 11 o'clock Pacific time. You've joined us at Building State and Local Partnerships to Support Familiar Faces. My name is Hallie Fader-Tao. I'm serving as the Interim Director for the Behavioral Health Team at the Council of State Governments Justice Center. You've joined us today to learn from the experiences of two very different states, New Mexico and Georgia, about how they built on local efforts to serve people who are familiar faces, people who have high utilization of multiple service systems, how they built on those local lessons learned and effective strategies to develop state policies that scale up these initiatives, as well as remove barriers for localities in serving familiar faces. So our conversation today is going to have a lot about collaboration. We're going to be talking about locally, how justice, health, and housing partners can come together to develop effective approaches for supporting familiar faces, how urban and rural counties across the state have advised state-level task forces that included all three branches of state government to develop consensus-based, research-driven policies to support familiar faces in their state. I am really excited to have our speakers here from Georgia and New Mexico share with you what they did and what they've learned from it. If I can have the next slide, please. I'm so proud of the group that we have here today. In alphabetical order, we have Chief Justice Michael Boggs from the Supreme Court of Georgia, Walter Katz, the Vice President of Criminal Justice from Arnold Ventures, Amy Michael, the Director of the Doña Ana County Health and Human Services Department in New Mexico, Evan Mills, Director of Development and Housing Programs for Advantage Behavioral Health Systems in Athens-Clarke County, Georgia, Senator Jerry Ortiz-Pino from District 12, which is Bernalillo County, Albuquerque, for the New Mexico State Senate, Commissioner Kevin Tanner from the Georgia Department of Behavioral Health and Developmental Disabilities, and Justice Briana Zamora from the Supreme Court of New Mexico. Again, my name is Hallie Fader-Tao, and it is a pleasure to be here and facilitate this conversation. Next slide, please. Just to give you a sense of what we're in for together. First, we are going to do a welcome and just an introduction to the project. Then we'll have a discussion among the panelists about what they did in their communities and in their states to develop policies for familiar faces. And then we're going to try to save some time at the end for audience question and answer. If you have questions that come up for the panelists, please feel free to put them in the chat and we'll bring them up during the Q&A session. If you have any technical difficulties, also please use the chat for that as well. Our wonderful colleague at the Justice Center, Andrea Chambers, is also standing by to provide support if folks are having technical difficulties. If she's not able to respond through the chat, please email her at achambers@csg.org, and she will do her best to help you. We will put her email in the chat if you aren't writing that down quickly. And just as a matter of housekeeping, this webinar will be recorded and will be posted on the Justice Center's website in about 2 weeks. We will also post the slides there. So if you're looking for a copy of those, come to our website. All right, thank you so much. So Andrea's email is in the chat right now if you're having technical challenges. And otherwise, let's move right along. So by way of welcome, I would like to turn to Walter Katz, who is the Vice President of Criminal Justice at Arnold Ventures. AV has been the supporter of the States Supporting Familiar Faces work, but this is only part of a broader portfolio of work that Arnold Ventures has supported. And I'd love to turn the mic over to him to say a couple of words of welcome.
Thank you so much. I appreciate it. And good afternoon and good morning, everyone, for wherever you may be. I'm Walter Katz, Vice President of Criminal Justice at Arnold Ventures. And for those who don't know, the initiative that was formerly known as Data-Driven Justice came to Arnold Ventures in 2017 under the leadership of my predecessor, Lynn Overman. Through our other core partner, the National Association of Counties, we supported the piloting and expansion of what is now known as the Familiar Faces Initiative. However, we and some of the folks on this call also saw the promise of supporting a state-level effort to help people who are high utilizers of local systems and that too often lead to unnecessary and extended incarceration. The purpose of our support of this vital project, led by the CSG Justice Center, was to launch a 2-state pilot to help states reorient their funding and policies to support local data-driven strategies to improve outcomes for familiar faces. We are thrilled with the progress that has been made in Georgia and New Mexico. This was a roll-up-your-sleeves effort, and it is a testament to the importance of this work that we are joined today by Chief Justice Boggs of the Supreme Court of Georgia and Justice Zamora from the Supreme Court of New Mexico, as well as other vital officials who have made this happen. Our many thanks as well to the dozens of people across Georgia and New Mexico who took a deep dive into the policies, practices, and data collection to improve outcomes for the people who need it most. Behind the scenes are the practitioners who provide help to the most vulnerable members of our communities with little acclaim or recognition. Their efforts and dedication needs to be recognized. Finally, I want to thank our friends at the CSG Justice Center, whose facilitation, leadership, and support has brought what was once just an idea to life. Thank you so much, and thanks for joining us today.
Thank you so much, Walter. And for those of you who are interested in learning more about the Familiar Faces Initiative, which is led by our partners at the National Association of Counties, we'll certainly make sure you have access to those resources as well. So as I said, my name is Hallie Fader-Tao. I have the honor to serve as the Interim Director for the Behavioral Health Team at the Council of State Governments Justice Center. CSG is the National Membership Association for all 3 branches of state government, and the Justice Center is the crime policy arm of CSG. So our team of about 135 and growing around the country exist really to distill research, data, best practices to support policymakers, practitioners, and community members around the country on a range of issues. Our behavioral health team has been so excited to work with New Mexico and Georgia on this project. So during our time together today, we're mostly going to be in conversation. When you have several Supreme Court justices, a senator, a commissioner, high-level practitioners and administrators on, we're not going to spend a lot of time on slides. We're going to really be in conversation. And as you listen, I'd love for you, I'm hoping that you're going to be able to pull out some of the essential elements of what made it possible for these states to build state and local coalitions that were able to scale up local efforts. We're also hoping you're going to hear ways to to gather and use data in order to identify familiar faces and shape policy priorities. And finally, we're hoping that you're going to hear practical, very actionable policy strategies and practices that help improve outcomes for, as Walter said, people who are often the most vulnerable in our communities. So I'm just going to take a little bit of time to give some background so that we have a shared foundation of familiar faces and what the State Supporting Familiar Faces Project is. If I can have the next 2 slides, please. So in this context, when we're talking, and the next slide, please. In this context, when we're talking about familiar faces, we're talking about people who have high utilization, frequent contacts with multiple sectors. In this context, criminal justice, behavioral health, housing, homeless services, and the populations that both teams in Georgia and New Mexico were focusing on are people who are in that inner part of the Venn diagram, where there is that overlap of frequent justice system involvement, frequent utilization of emergency services, frequent contact with homeless services or housing needs, and a sense that business as usual is not working for this population, that there needs to be a concerted effort across systems in order to change or break the cycle of incarceration and use of emergency services. During one of our stakeholder groups it was a police chief in Georgia who said, there are some faces that are very familiar, and they did it in an accent more like Commissioner Tanner's or Chief Justice Boggs, but it really spoke to what many people observe on the ground, and I imagine many of you who are joining us here today, there are some people who you see frequently come, whether it's police contact, emergency medical, homeless services. There are some faces that are very familiar. In thinking about familiar faces, and this is a little bit of a data nugget, we're often talking about familiar to the criminal justice system. And you'll see in some of the data that we're showing, we're starting with those who have the highest frequency of jail bookings, but also thinking about who are high utilizers of multiple systems. So not just top 1% or top 5% or top 100 in the jail bookings, but also in terms of utilization of community behavioral health services or emergency rooms or homeless shelter. Nationally, their estimates are that about 9% of jail bookings jail admissions are familiar faces. That I'm pulling that from a recently published handbook on jails and prisons, the chapter on frequent utilizers by Zotola. And so this 9% of bookings utilize a much higher percent of resources, around 25% of the resources. And different communities are able to use data to start identifying this population and then thinking about how to change policies so that the revolving door stops or at least slows down. So if I can have the next slide, please. As Walter said, the National Familiar Faces Initiative, supported by Arnold Ventures and the National Association of Counties, supported communities around the country that were interested in working locally across systems to share data and identify people who were familiar faces and build policies and programs to address their needs. At the Justice Center, as we started looking for states that would be interested in states supporting familiar faces, we looked for states that had a number of communities that were already doing familiar faces work. So we looked at sites that were part of the Familiar Faces Initiative, part of the MacArthur Safety and Justice Challenge, or the Stepping Up Initiative, or were recipients of the Justice and Mental Health Collaboration Program grants. These were some indications that states, that communities already had familiar faces initiatives going. And then we looked for states where there was a critical mass of those local initiatives, as well as committed leadership across 3 branches. And we were so thrilled to find that in states as diverse as Georgia and New Mexico. If I can have the next slide, please. So over the last 2 years, we've been able to work in these 2 states with what we've been calling coalitions of counties. So in New Mexico, there were 10 counties that said, we want to participate. There's a local interdisciplinary team who's working on familiar faces, wanted to learn from their peers, and also wanted to inform state policy efforts. In Georgia, there were 12 counties that put up their hand and said, I want to participate. Same thing. And these were not just Albuquerque and Atlanta. These were rural counties, suburban counties that all got together to share information about familiar faces with each other, and then with 3 branch task forces at the state level. Next slide, please. In each of these states, they were able to pull together data to start to share a picture of who familiar faces are. So we're showing here some of the findings from a local study in Fulton County, Georgia, where they looked at 100 familiar faces and saw how much more frequently and how many more jail bed days the familiar faces occupied than the general jail population. Georgia was also able, through their Criminal Justice Coordinating Council, to do an analysis of 9 jails looking at people who were charged with felonies to identify statewide trends around familiar faces. So they looked at the top 1% of bookings from diverse jails and were able to see how much more frequently familiar faces were booked, how much longer they spent in jail. And then also one of the things that was really interesting from this study was that they were able to see that for people who were familiar faces who also had a mental health flag, there were much shorter times in the community in between jail bookings. And so that opens a window into, okay, we have a certain amount of time generally that people are spending in the community. How do we make the most of that to expand that time before another booking, or ideally get rid of another booking? Another thing that was very helpful from these analyses was that in the Georgia study, while they were felonies, the stakeholders were able to see that by and large they were not person-related offenses. So the types of charges or the true risk to public safety posed by people in that familiar faces group. Next slide, please. In New Mexico, Bernalillo County, which is where Albuquerque is, they were able to match local data to look at the people who, at a group of top users over an 18-month period and see how they overlapped in different data sets. So people who had been in jail, who had also been in the hospital, had also been assigned to the jail psych unit, to see that how much higher the service utilization was, to get a sense of the impact of a relatively small group and understand the opportunity to better align those resources. So what we saw already in these two states was stakeholders coming together to share data, to understand the familiar faces population, and also start to identify policy opportunities. So with that, I'd love to ask Andrea to pull down the slides and bring up our panelists, our wonderful speakers. And Chief Justice Boggs, sir, I'd love to ask you the first question and hear a little bit from your perspective about why Georgia decided to join the State Supporting Familiar Faces Project, how it got started, and how what you did to build a Familiar Faces Advisory Committee in your state of Georgia.
Thank you, Hallie, and hello to everyone. Particularly, Walter, thank you for the kind introduction and for the opportunity to join again with Arnold Ventures in a project that is so meaningful to the citizens of our state. So thank you for that opportunity. We're pleased also to be able to work again with the Council of State Governments Justice Center to provide technical assistance through that program to our state. Georgia has been through a process of about 8 years from 2010 through 2018 of criminal justice reform. I had the pleasure of co-chairing the then Governor Deal's Criminal Justice Reform Commission in our state. And so we had some great opportunities to make some significant changes in criminal justice policy. A thread running through all of the policy that we implemented dealt predominantly with the overrepresentation of individuals with behavioral health and/or substance use disorder problems in our jails. And so it was natural that current Governor Kemp would create a Behavioral Health Reform and Innovation Commission. Commissioner Tanner, who has joined us today, is chair of that commission. I had the pleasure of chairing the Mental Health Courts and Corrections subcommittee of that commission. During the work of that subcommittee, it became readily apparent that we really needed to address this overrepresentation of people with behavioral health needs that are falling through the cracks of community support services that are overrepresented in our criminal justice system. I come from a background, notwithstanding being an appellate court judge now, I'm a former trial court judge in 6 counties of our state, where I presided over felony criminal matters, among other things. And so none of this was particularly new to me, but the data was fairly new. And the data really drove Georgia's decision to join this project and to be engaged more fully. We knew that approximately 20% of people in our jails nationally have a serious mental illness compared to roughly 4% of the general population. Georgia is really no different than these national data suggest. In one Georgia county, which Haley just eliminated for you, there was a 5-year study that revealed that people with mental illness in our Georgia jails in that county stayed 3 times as long as the jail population without mental illness. And we know the cost of that extended stay is an enormous burden on the taxpayers in that particular county. In Fulton County alone, just where the capital city is located of Atlanta, we found that familiar faces were booked into our local jails 10 times more frequently and used 20 times the number of jail beds than the general jail population, which cost Fulton County taxpayers $1.3 million annually in jail bed days alone. Another study that Haley put up on the screen a moment ago, conducted by the Georgia Criminal Justice Coordinating Council, looked at people who had been booked the most, the top 1% across 9 diverse county jails in Georgia. Not surprisingly, they found that familiar faces, people, high utilizers, were booked into our jails on average 15 times over the 5-year period, or about 3 times per year. And so these data and this idea of a sort of a data-driven justice project really firmed up for us what we anticipated all along in our state, not unlike any state, certainly not unlike New Mexico either, where we recognize that this population can be probably more readily and appropriately dealt with to the extent they're involved in our justice system. And so part of it, Haley, was our interest was trying to make a difference and address the moral imperatives to address this population in a more appropriate manner. But the data really directed us to get engaged in this. And to me, it was somewhat of a really natural or intuitive sort of pivot from 8 years of criminal justice reform, where this issue was really below the surface on almost everything we did, to now more precisely and purposely addressing this particular population with agenda items and initiatives in our respective state. So we created this Behavioral Health Reform and Innovation Commission by legislation. The governor created it. The Mental Health Courts and Corrections Subcommittee was but a piece. We had 5 subcommittees, just to give you an idea of the breadth of our work and kind of how familiar faces we were. The overall commission dealt with hospital and short-term care facilities. We had a committee dealing with workforce and system development, a committee dealing with involuntary commitments, children and adolescent and behavioral health issues, not unfamiliar any of these issues to those listeners today, but also the Mental Health Courts and Corrections Subcommittee. And it was during the work of that subcommittee that I chaired that was largely staffed by prosecutors, defense attorneys, and judges and law enforcement that we really felt the need to move toward addressing a familiar faces population. And so I created the Familiar Faces Advisory Committee. We met over 7 months from June 2022 through December of 22. Our goal was really to identify impactful, palatable, and feasible policy recommendations to be included in our report, which we filed in December of 22. And then we, of course, made sure that Familiar Faces Advisory Committee, which is made up of about 18 people, that I selected with the assistance of the Commissioner of the Department of Behavioral Health and Development and Disabilities. That committee really set out to do the heavy lifting, heard from various stakeholders, and intended to be a very collaborative and thoughtful, inclusive process to help generate some recommendations that we can make to the General Assembly. Hallie, that's
Thank you so much.
Kind of the background on how Georgia got involved in a Familiar Faces Committee.
Thank you so much, Chief Justice Boggs. It's interesting how you were able to sort of put this focus onto some existing standing work that was going on at the state level. I'd like to pivot to the West to Justice Zamora from the Supreme Court of New Mexico. Can you talk a little bit about how Familiar Faces became a focus for your team and sort of New Mexico's journey to this point?
Sure. So I too was a trial court judge, and when you have a firsthand experience dealing with familiar faces and really seeing the issues, it gives you a lot of perspective. And that's all I did for 10 years was work on adult criminal cases from misdemeanors to felonies in treatment courts. So when I came to the Supreme Court in August of 2021, I really wanted to start a mental health commission, and I felt like it was a gap in maybe our judicial work. I also knew that we weren't collaborating with other branches of government much. And so the Supreme Court gave me the go-ahead to start looking into it. And then in March of 2022, the timing was perfect because that was when we were approached by CSG regarding the Familiar Faces Project. And that is right along the alley of where we were trying to direct our work. New Mexico is very diverse. I noticed the counties are smaller in Georgia. Ours are huge. So to get from one place to another for treatment or medication or anything, it's quite a drive, and we're very diverse. We have large cities and we have towns, very communities where there's just not a lot of people. So we, in New Mexico, unfortunately, substance use and overdose are huge problems. Our alcohol overdose rate is the highest in the nation, and our substance use overdose is also up there as well. We have similar issues as far as individuals with severe mental illness and co-occurring disorders. What I didn't know, and what CSG really helped bring this together, and then the committee, is that other people shared my concern and passion from all branches of government. I mean, legislative, executive, behavioral health specialists. And we also didn't realize that there were a lot of programs and good ideas already starting up that we just hadn't communicated to each other. So what we decided to do was create a subcommittee of the Supreme Court's Mental Health Commission, and it was specifically designated to address the familiar faces and the work we did with CSG. It was a broad group. This had multiple counties, both large and small. We had legislators. In fact, Senator T.C. Pino's here. He was one of the chairs and leads and huge supporter. As well as local government leaders and our behavioral health specialists, who I call the experts. I mean, I'm law trained, so I always want to know, what do you think is really the behavioral health solution? So we had everyone involved. We met twice a month, and we just stopped meeting recently. And we worked on policies that were impactful for the state, surrounding medically assisted treatment, severe mental illness, as well as looking at programs. And it was weird, before this commission had started and kind of looked into how can we get on the ground and look at the day-to-day changes we can make in these individuals' lives and in our community. New Mexico had done some major criminal justice reform as well. You know, we had changed our pretrial detention. We had expanded pretrial services. Laws had been passed, but we never really took a hard look at what can we do when these individuals are coming into our courtroom, into our hospitals, into our communities, and how can we best address them? So that's how we initially began and started our work. Thank you.
Oh, thank you both. It is so exciting to see leadership from the judiciary as conveners and agenda setters. As Walter said at the beginning, the approach with this project was to build on what localities are already doing and see where there are opportunities to scale that up to other communities or to remove barriers through state policy change. Now, there's a whole range of things that could be done in that area, and I'd like to turn it now to my colleague Amy Button, our project manager, to talk a little bit about the process for collecting data about what was happening in these two states and sifting through to identify policy strategies and priorities.
Thank you, Hallie. We used a number of different strategies and approaches to understand the work that's happening locally in both states, to give the local teams perspective about how deep their experience is collectively and to help their state policy partners to understand that work. We initially met with the counties that Hallie described. We knew were already doing this work, that were using data, had a focus on diversion strategies. We're building out a continuum of care and services in their communities. So we identified those counties, invited them to meet with us to learn about the project and to hear from them about their local practices. What is happening in those three areas of data, diversion, and building out a continuum of care. So we got a lot of information from them. We heard from them about their local practices, priorities, and the barriers, and we asked them if they'd be interested in participating. The ones that said that they wanted to participate, we brought together at a county convening so that they could hear from each other about what their experience and priorities are, to prepare them for partnering with their partners at a state level, policymakers, and to hear from them what they thought the project would look like at the end when it's successful. Those convenings were in May in Georgia, August in New Mexico. We brought both states together in April. We also used focus groups because we needed to dig deeper into a number of different topics. Justice system strategies, data collection. What does that really look like on the ground? Because it's so much variability. And again, more information on community-based practices for community supports, housing, behavioral health, crisis, and so on. Throughout the project, we met with subject matter experts to flesh out policy ideas and strategies, housing experts, prosecutors, defense attorneys, forensic behavioral health experts, and especially state agency leaders who were very generous with their perspectives and time and advised the project, and both state and local practitioners. We conducted a number of listening sessions and dialogue sessions with peers in both states that are leading the design and the delivery of peer services in both states. And then finally brought all of this information and the data gathered from these series of meetings to the advisory committee or the task forces, which under very skillful leadership reviewed all of the information, considered policy options in an iterative way, and some policy objectives of what they wanted to accomplish with this very community-driven information. Between June and November in Georgia, and between August and December in New Mexico, both states developed and refined slates of policy recommendations that they in turn brought forward in their states and moved into implementation. So that's basically the process for making sure that we pulled in that local information.
Oh, thank you so much, Amy. And I'd like to turn now to two of our local representatives. First, to the Director of Development and Housing Programs, Evan Mills, who's in Athens, Clarke, Georgia, and then to Jamie Michaels from Doña Ana County in New Mexico, to understand from you sort of what you were doing locally and how you heard what you were doing locally come into state policy strategies. So Evan, can I turn it to you first?
Sure. Thank you, Hallie. So I think, from the provider perspective, one of the most beneficial things of this whole exercise is exactly the process that you guys went through of getting such a diverse array of subject matter experts, and promoting the ability for us to come together and share different perspectives over this very complicated problem. If this was an easy problem, it would have been solved years ago. This is one of those things that we need to have consistent conversations and consistent methods in which we inform the community and inform those leaders within our communities, within our states, the policymakers, the influential, the drivers, the folks that can help us make changes. And so this effort that you guys, helped us, sort of facilitate, bringing everyone together and having open, honest, frank conversations and communications about, what our barriers are from a funding standpoint, what our barriers are from local services infrastructure standpoint, what our strengths are, what our opportunities are. And there's such unique differences and comparisons between, suburban, urban, and rural communities. And, we had a chance to bring up all of those topics and kind of, share what's been working, share what could be improved, what could be better. And it was a tremendous opportunity to, have that and then sit at the table, with people like Chief Justice Boggs and the leadership within the Georgia Department of Behavioral Health and Developmental Disabilities, and, the policymakers and the drivers to, help inform where the priorities are. It's such a complicated problem that has so many different facets that we as service providers on our level get to overcome daily. And sometimes, and I think it's human nature, for those of us who may not necessarily be involved in the day-to-day practices of service provision, we can tend to maybe simplify the nature of the problem and come up with some solutions that might, look good on paper, look good on chalkboard, but when actually implementing some of those, there are barriers, there are gaps that, we may not necessarily take into context, but this activity that you guys allowed us to come together and have this conversation helped inform that. And I think, through Justice Boggs' leadership, I think we as a state did a very good job at, promoting a level where everybody was able to communicate. And we came up with some pretty unique and interesting policies that I'm hoping will be able to do some change, make some meaningful impacts. We have already. There are a lot of successes across the state, and we have made a huge amount of difference, within the federal funding and the state funding, administered through DBHTD and DCA and the other organizations. There's so many successes out there. There's still a lot of work to be done. And I look forward to hopefully continuing this conversation and this communication, because it's something that needs to be continued as things change. People are complicated. Humans are complicated. And, these familiar faces that, they bring a lot of challenges. They also bring a lot of strengths. And it's, our success is really defined on how well, we can work with them in order to help them find and attain sustainability. So.
Thank you, Evan. I'd love to hear from you. I noticed in the chat folks had questions about like, well, what specifically are you doing? Is there one or two policies that you saw sort of come up from the county level and make it into the state stage?
Well, I can say at the county, I will say we've got some great successes at implementing what we call harm reduction and housing first approaches. And I think that those are two concepts that are probably familiar with the majority of the folks attending this. But the key here and the interesting piece here is, it's one thing to understand the philosophy behind it. It's another thing to actually implement that and put that into practice. And that is leading with compassion and leading with engagement and relationship development with individuals that have a lot of barriers and have a lot of issues and that do fail many times and do find themselves, back in the same situation, having setbacks and everything. So us being able to operationalize a housing focused program that can allow for someone to have a setback, to make a mistake, to do something that might be detrimental, but do that in an open and honest, transparent way that they can come back to us and we can continue to work with them and identify the trigger, identify what was going on with you, and how can we continue to work with you, and to promote that conversation, which I think is what the advisory council did so well, is to understand the concept around that so that we can promote having these conversations between service providers and justice officials on how we can better partner and better communicate with the local court system, the local jail system, the local law enforcement agencies, because we're all sharing these same individuals and we all see them and know them by name. And if we are better at communicating with each other as providers and justice officials that are interacting with these guys, that does nothing but help the individual come through. And that, from the top down, if that is made sort of prioritized by people like Chief Justice Boggs and leadership across the state, it really helps prioritize and strongly encourage our organizations to speak to each other on behalf of the clients so that we can, strengthen the network, the service network for these guys. So I hope that answered your question.
Thank you so much. No, absolutely. Thank you, Evan. If I can turn over to Jamie Michael in Doña Ana County in New Mexico, same question about what you saw working locally and how that either bubbled up at the state level or some local concerns were able to be addressed through the state policymaking process.
Yes, Hallie, thank you. I think I will echo the similar components to what other folks have talked about, the importance of the county convening and then the connection to that statewide subcommittee. But first, I just want to give a little kind of profile about New Mexico. A couple things. I know every county and state is unique, but in New Mexico, we have a centralized health department. So the resources and policy and infrastructure for the public health system, including behavioral health, housing, and other resources, comes from state government and then flows out. So our infrastructure is different than other states. We also have a legislative body that convenes once a year for either 30 or 60 days. So, and that happens at the state capitol. So oftentimes county government, although we rely heavily on state government, we can be very disconnected because of the infrastructure. And then as Justice Zamora talked about, just geographically, the space and distance that we have in New Mexico. So I think the process that started with convening local county groups that were already doing similar work. So building on what exists in our local counties, and again, looking at counties that were extremely rural and counties that were more populated and had more resources was really important. And that allowed us to get kind of a good depth and breadth of the issues and the resources. So I think it was both looking at gaps and needs, but also assets and resources. Because if I could hear from another county what they saw as an asset, maybe I could look into my county and find that resource as well. So I think that first step of really bringing together a diverse group of counties, started off with 4 and expanded to 10 different counties in New Mexico. And we were able to have conversations together, and coming together as county government adds some strength to our work. And then taking all of that and moving it to the state stage through that subcommittee. And I think what was key with that subcommittee is we had the champions there. We had Senator Ortiz-Pino, we had Justice Zamora. How often do you have those champions already there, already willing to work and wanting to hear from people at the local level in the counties? So the local work that we were all doing, and then coming together twice a month. I think the frequency of those meetings was important because things didn't get lost. We were able to come together, and the timing was also right with those statewide subcommittee meetings because we were prepping for the upcoming legislative session. So state executive representatives, legislative representatives, justice representatives that guide statewide policy were able to talk, but we're able to talk in a room that also included county folks and people who are actually delivering the service or receiving services in our local communities. And that conversation was really valuable. So I think it helped us develop stronger legislative priorities and a very thoughtful process for developing those priorities, because we had everyone at the table. Without that process, what I've seen in the past is during those 60-day legislative sessions, there's legislation, and right before it goes into a committee meeting to be discussed, people are coming up and saying, but did you remember and did you think about what it's going to look like in our local community? So we were able to have much more strategic and thoughtful process around developing these policies. And again, using data. So the locally driven, but data informed, I think are 2 key points. Again, at the local level, we're able to talk about what data we are able to collect and what barriers we have to collecting some of that data. And sometimes the barrier was state policies. So we're able to immediately say, we don't know this data in our community because, and the correct people to hear that were sitting at the table with us. Some examples, again, the diversity of our communities and our counties. The work that we do is very similar, but what it looks like can be very different. So in some smaller counties, they were able to identify all the folks within those three systems, the three circles in the Venn diagram that you showed at the beginning. They were able to identify all of the providers and folks that touch each of those systems, bring them together. It's a small enough community, can all sit around together and talk about how those systems work together. They already knew people by first name in some of those small counties, and they were able to quickly look at data and identify familiar faces. And then the handful of counties that are larger than that, it is more difficult to get all of the providers around the table. Providers in the behavioral health system, the emergency response system, and the court system. So they started out in Bernalillo County, they started out by creating a priority list of individuals. They started, here's the list of people, and now let's see what systems they touch in our community and work that direction. So I think the informal ways of sharing, collecting and sharing data, and the more formal ways of sharing and collecting data are both important, and that communication between local folks and state leaders is really essential.
Thank you so much, Jamie. And I'll segue right over to the state with Senator Ortiz-Pino. So, you know, you were on the committee hearing all of these local experiences, hearing about common themes and challenges. As a legislator, how did you sift through this to identify policy priorities? Where did you see opportunities?
Yeah, well, thank you, Hallie. One of the big things was that even though our counties are very diverse, the communities and the counties, the issues that kept surfacing had a very familiar ring to them. We were able to identify real commonalities among the issues, but what was valuable was for this committee, the subcommittee that was the Familiar Faces subcommittee of the Supreme Court Commission, was able to pull it together as a kind of a clearinghouse where we were able to hear how the need for housing, for example, was being dealt with in Otero County, in Doñana County, in Bernalillo County, and that diversity of responses that the individual communities had come up with proved to be very valuable. At the same time, the other thing that we really found beneficial was because so much of our resource in a centralized state like New Mexico, a lot of our resources are concentrated far away from the local communities. This provided a way for us at the legislature, at the Supreme Court, at the executive branch of the state government, to hear directly from local communities about what would be the best way of using those resources. So it's proven to be a very beneficial approach, and I would hope that even after this particular project ends, we would be able to continue that kind of breaking down of the walls, or opening up, maybe is a better way of thinking of it, of the channels of communication from local to state. Some of the things that we were able to come up with, I think, are worth talking about. We tried to be very pragmatic in what we recommended. We have such enormous needs, and we have such few resources in a state like New Mexico, typically, that all of a sudden now, when we have oil and gas money pouring in, when we have opioid settlement money available, the possibilities of actually using some resources to solve some problems became very exciting. But we had to, among those, we wanted to keep things very practical. And so here are some of the things that we were recommending to the Supreme Court Commission, to the legislature, and to the executive departments of the state. First, the recurring issue everywhere was the need for affordable housing. In a city like Albuquerque, it takes the form of the homeless that we see on the streets or camped out in our parks. But in smaller communities, it takes the form of trailer parks that are being closed out, and the people being evicted because they're being sold for to another company that wants to upgrade the kind of trailers that are included there. It might take the form of what happens when people come out of mental hospitals and they go into these boarding homes, many of which are very inadequate. As a result, housing as a recurring theme was one that came up, but each individual community sees it from a slightly different angle. And so we've tried to find resources for all of those visions. Another one was a recommendation was to find a common definition for the issues that we're dealing with. For example, serious mental illness. What does that mean? In the courts, what does that mean in the hospitals? What does that mean in the behavioral health clinics, in the schools? How do we really communicate effectively about the same problem if we don't have a common vocabulary? So we're trying to work on that. And similarly, adopting common measures of success. How do we measure change in individuals, change in communities, change in policies? Are they effective or not? How are we measuring that? So that's another focus. One of the biggest things I think that's happening is the commission is making recommendations for some statutory changes in how we view competency in the courts. We really found that this has been one of the major contributing factors to the revolving door, the familiar faces that continue cycling through our emergency rooms and our courts and our institutions. And if we could have a more up-to-date vision of what competency and what's the state's responsibility for helping individuals who have serious drug or alcohol or behavioral health problems. I think the other thing is that we realized most of the services that are proving effective are the ones that are locally driven, and that for us at the state level to try to design something, just that a much better model would be for us to provide resources, technical assistance, but that the local service providers and local governments would be the ones who would create the actual responses that work best in their communities. Then another one was on medication-assisted treatment, and we realized that in the urban areas there's access to for those with addiction problems, there's access to Suboxone and methadone, but that in the rural communities that was not the case. And in jail, we were letting people who were in jail, we were releasing them after they'd served their time, and they go right back into the same addictive behavior cycle because there weren't treatment resources. So this, the Familiar Faces Project coincided with an initiative by the health department to expand medication-assisted treatment through all of the county health offices, but also in our jails. And we're going to be able to do it in our prisons using opioid settlement monies for that. And then finally, we wanted to, and we were able to do a bill this year that dealt with an issue that I think contributes to the large number of people with intellectual deficits or developmental delays or disabilities that winding up in jail, inappropriately in jail, and that is our language and our statute has been very punitive and not really reflective of current practice. And so we were able to modernize our statutes regarding the language and those things. And those are some of the recommendations we've made now to the commission. I would hope that a lot of these initiatives continue long after this project ends.
Wonderful. Thank you so much, Senator. Turning back to the East Coast, Chief Justice Boggs, sort of similar question. How did the Familiar Faces Advisory Group sift through the information? What were the policy priorities you all identified to pursue?
Well, thank you, Hallie. You know, like New Mexico, we identified policies based on political palatability, but also on impact and feasibility. I mean, we were really looking for things that were going to make a difference and, in a word, move a needle. Our process, as I've already alluded, was collaborative. It was inclusive. We listened to a wide variety of of diverse stakeholders from a cross-section of impacted community leaders and community agencies. So we identified a large pool of possible recommendations through our committee meetings from a data collection process that you just heard about from Amy and Evan. Very similar to that, we facilitated a discussion among committee members on how impactful and feasible these recommendations might be. And not surprisingly, we really kind of then prioritized by feasibility impact what we were going to be asking the General Assembly to do. And I would remind the listeners that you know, this sort of policy reform traditionally is talked about in the context of legislation and legislative actions. We also thought about budgetary actions and ways to do things through a Budgetary Appropriations Act and also through administrative actions, which we will talk about later. But ultimately, we identified several, 9 or 10 really data-driven cross-system recommendations that fell into one of 4 identified categories that were deemed priorities for my Familiar Faces subcommittee. First, the policy area that we looked at was how do we bolster capacity to identify this group? I mean, it was very challenging. I think other states are going to have this same challenge. Is to trying to fix a problem is difficult if you don't know the breadth and the depth of the problem. And we really didn't in Georgia understand capacity issues. We heard anecdotal stories, and so we really set out to develop some state level guidance to standardize and streamline the information sharing that local system partners could opt into to implement. We didn't even have a standardized definition of serious mental illness, something that very hard to gauge. How do you remediate an issue with this population without everyone speaking about this population in uniform terms? One of the challenges was that we had, we're a large state. As others have mentioned, our states our counties are kind of small, but we have 159 counties in Georgia, probably 150 or so jails. All of those jails don't do behavioral health or housing screens. And the ones that do don't necessarily always do that in a validated and appropriate way. And so we wanted to provide fundings to jails to implement validated housing stability and behavioral health screenings using standardized definitions so that we could then gauge the breadth and depth of the problem. The second policy area that we focused on was once you identify this population, what do we do? And so we moved to improving community responses to Familiar Faces. So how do we respond to that population? We found a small number of community-based coordinator positions to build collaboration between community justice and behavioral health partners. Evan talked about the importance of collaboration between service providers and justice system partners, and I lift that up as an example of kind of what we were trying to do. We figured out a way and supported DBHDD, our Department of Behavioral Health and Developmental Disabilities, to conduct and contract for analysis of non-crisis beds in Georgia for this population, and to look at short-term housing and diversion options, both psychiatric respite care centers and otherwise. We worked really hard on how we were going to improve community responses to this population by looking at reducing wait times for state hospital beds and competency. I've created yet another committee to deal with, I think the Senator just mentioned this, but every state in my conversations with the Conference of Chief Justices is dealing with questions concerning backlogs on obtaining competency evaluations in a timely fashion. And so I've stood up a competency evaluation committee to really be thinking about how can we reduce wait times for these evaluations while these individuals are either decompensating or otherwise in a county jail. So we've looked at that as policy area number 2. Thirdly, once you bolster your capacity to identify them and you figure out how your community is going to respond, you have to really increase and expand access to high quality care. So that was the real third pillar of our stool. We expanded and made recommendations to expand jail in-reach services in Georgia, efforts to increase housing access and availability. Housing instability is an enormous problem with this population. We all know that. but having resources to build up these housing options is extraordinarily difficult. We addressed through some really thoughtful thinking, I believe, how do we expand our behavioral health workforce shortages in a state as large as Georgia, getting competency evaluations that are mandated to be done by Commissioner Tanner's agency here in our state, having a dearth of family practitioners, forget psychiatrists and psychologists and providers, but in the rural parts of our state, a real healthcare service delivery system problem that manifests itself at the doorsteps of our trial court judges oftentimes. And so for us, it was really building workforce, helping to build behavioral health workforce shortage strategies. And then we also strengthened Georgia's peer support specialist capacity, something that we had been needing to do for quite some time, but that was all about expanding access to quality care and supports. You can do a lot of this, but we recognize that if you don't build all of this sort of contemporaneously, there will be folks that slip through the cracks. And our last policy area was really about information sharing, and we developed some strategies to establish a statewide clearinghouse for best practices and information and resources across communities and across systems in Georgia. The challenge in our state, and I suspect in many states, is siloed information, inaccurate information, incomplete information, information that is not shared. Our judges across our state, not unlike judges across the United States, are not making informed decisions on pretrial release and sentencing decisions with accurate information. And I want the judges to be making decisions based on accurate information, and they simply don't have access to a lot of the behavioral health information for reasons that we're all aware of. So those were the areas we looked at to prioritize as policy recommendations, and we've been fortunate to be able to move forward on some of those.
Thank you so much, Chief. I wanted to turn to Justice Zamora, who I know has a busy calendar. And one of the things that's come up in both of the conversations has been in both states has been competency to stand trial. And I was just hoping you could say a couple of words about how you're pursuing that through multiple strategies.
Yes, I can. Like Chief Justice Boggs said, I think, I know in New Mexico, one of the most often familiar faces we see are the individuals with severe mental illness, and that's in the courts, and that's in the hospitals, and that's in our local communities. In New Mexico, we've tried to streamline court processes, but we've never really looked at what services are we providing these individuals that perhaps will give them an opportunity to have less frequent contact with these other stakeholders. So our competency statute has not been amended since the late 1970s. In New Mexico, these individuals have not gotten treatment. They've merely been educated to understand the process of competency. Our statute does not allow for outpatient restoration, and we really haven't looked into expanding sort of outpatient treatment opportunities for these individuals. So I'm pleased that a group of us work together from the various branches of government, as well as folks with different expertise, to come up with a draft of a statute that will be more modernized and will allow for some of these things. We are also piloting a diversion program in 4 jurisdictions. It's the first of its kind. We thought, why not connect these individuals who repeatedly get misdemeanor cases in our justice system, find a way to immediately connect them to services such as housing, like we talked about, such as behavioral health treatment, such as medical treatment. So starting next March, in 2 large jurisdictions and 2 small jurisdictions, we will start this pilot project. We will have forensic navigators for the first time who will immediately divert these at arraignment to treatment. So I'm really excited about that progress. But we've implemented all of the work we've done as familiar faces in it. We've been able to, the severe mental illness definition has been critical to our policies and procedures and the process. and both in changing the statute and in the pilot project, identifying housing and the unique needs of our smaller jurisdictions and our larger jurisdictions. Data collection, I feel, is the biggest challenge, and we've had to really have some serious discussions about that, as well as a lot of these individuals who have co-occurring disorders, and making sure that they do get the medication that they need, regardless of where they live or what resources they have, and that there's not that gap when they leave the county jail, as the senator talked about, to get whatever medication they need. So those are sort of the things that we're working through, but it will be the first time in New Mexico that individuals who normally just go through the competency process and get their case dismissed or are hospitalized will actually be connected to services. We realize as a court and as a judiciary, this will require rebuilding their trust, because that we've never done that before. We actually really do want to help them and give them the resources they need. So CSG has been wonderful, because we just kind of decided this the last 6 or 7 months, and they've really provided us a tremendous amount of support. So I just want to take this chance, since I'm about to leave, to thank you and all the resources you helped us with, because it does require a lot of training for our judges and our attorneys and our staff, because this is not something New Mexico's done before. And it's really a mindset shift in how we administer justice in our court system.
Thank you so much, Justice Zamora. Thank you for all the work that you're leading in your state. I'd like to turn back to Georgia. I think one of the interesting things about the state policy work for familiar faces has been, we heard from Senator Ortiz-Pino about what he was focused on for legislation. We heard from Justice Zamora about some things that they're working on through legislation, others they're working on through pilot programs. Chief Justice Boggs, Commissioner Tanner, can you talk a little bit about how Georgia is pursuing some of the policy recommendations through administrative action?
You want me to take that?
I do. I would refer to you, Mr. Commissioner. Thank you.
Thank you. Well, first, let me thank CSG for having us today and for all your help over the last year or so. This process really started for Georgia back in 2019 in earnest. I served 4 terms in the Georgia General Assembly and actually was able to author legislation that created the Behavioral Health Reform and Innovation Commission while I was still in the General Assembly. And then we really found a champion in Speaker David Ralston. And we saw in 2022, in the legislative session in 2022, they passed House Bill 1013 that he actually carried, which is highly unusual in Georgia for the Speaker of the House to carry legislation. And it was about a 76-page bill that passed unanimously, and it was a mental health bill. They did a whole lot of things, but Chief Justice Boggs has been a champion for almost a decade now in criminal justice reform and the natural progression in dealing with our Courts and Corrections Committee of the Behavioral Health Commission and focusing on familiar faces. This legislative session in January of 2023, we had a bill, House Bill 520, that was the work of the Behavioral Health Commission from 2022 made into legislation. And that has not yet passed. We're on a 2-year biannual cycle, so that did not happen. But we took a close look at Justice Boggs' work and what we could go ahead and implement at the department level. One of the things that you've heard a lot on the call today, it's important for us to all be singing from the same page in the songbook with having a standard definition. And that was a challenge here in Georgia that Chief Justice Boggs and his committee pointed out. So I also get the opportunity to chair the Behavioral Health Coordinating Council here in Georgia, which is made up of all the commissioners and agency heads who touch behavioral health in some way, including the Department of Corrections, et cetera. And so we formed a committee because we have the ability through the regulatory process to create definitions and policies internally. That they're scheduled to report out actually tomorrow for the final time. This is a definitions committee that we will be adopting as agencies, which is going to set 3 definitions for all our agencies. One is the definition of serious and persistent mental illness. And one is familiar faces. We're actually going to define that for our agencies and what that means, so we're able to track that. So we're excited about that. And that will, and also the definition of homelessness, because again, that means something different to all of our agencies. Define that in a different way. One of the things we also was able to do internally is we found funding internally and redirected it to fund 5 jail in-reach pilot programs here in Georgia. We have those stood up in metro areas and North Georgia, South Georgia, and the Atlanta area. And the early work and the early data is very promising in those areas. But we're funding a full-time jail in-reach coordinator and a full-time forensic peer that work and are housed and have offices in those jails. We asked for 4 additional pilots for the next fiscal year budget. We're excited about those. Those individuals are working directly with the familiar face population to provide them services that they need and to direct them to community-based services where possible, or to provide them the treatment services they need while they're in jail, and they follow them into the community. We have a very successful forensic peer program in our state prison system. Our forensic peer program is ran by Lodgy, who spent 23 years in state prison. He has a serious persistent mental illness. He's in recovery. He does a tremendous job leading that effort, and he's working with our jail in-reach forensic peers and doing a tremendous job so far in that area. We also, Justice Boggs talked about the fact that we really didn't understand what our needs were as far as bed capacity. We completed a very in-depth bed analysis for both crisis beds and inpatient forensic hospital beds and adult mental health beds. That's been completed, and we have a clear 10-year plan of how to build out our crisis system and our inpatient system across the next decade. We also, Chief Justice Boggs talked about this, but as we were able to create the Forensic Competency Task Force as part of the Behavioral Health Reform and Innovation Commission, and Judge Kathleen Goslin, who's a Superior Court judge, mental health court judge, who's been on the bench for many years since the late 80s, is chairing that effort for us. And it's made up of the various courts and prosecutors, defense attorneys, and forensic experts. And they are putting forth some strong recommendations, and they'll report out at our full commission meeting in early December. So we're looking forward to getting that. We also completed a very in-depth statewide workforce analysis this year with Deloitte, not just looking at market rates, but also looking at innovative ways. How are we going to increase the pipeline of people coming into this workforce? That is our #1 challenge here in Georgia to success, is the workforce. We also created 2 statewide forensic positions to coordinate this effort across the state, and those individuals are in place. And Chief Justice Boggs talked about the need, and his committee talked about the need for a clearinghouse. We've been working with the University of Georgia over the last 6 months, and we hope to fund that center. And we hope to name that center actually after the late Speaker David Ralston. So it would be the Speaker David Ralston Center of Behavioral Health and Developmental Disabilities at the University of Georgia, which is his alma mater, and have that as also the clearinghouse of this data and information for our state. I've stole some folks from other agencies, and I know CSG worked closely with the Criminal Justice Coordinating Council, and Stephanie Lopez Howard, who I think is on the call, was their chief of data and analytics. She now works for us. So she's doing a good job tracking the data, because we want to make good data informed decisions, as Chief Justice Boggs often says. So we're excited about that. So we've got a lot happening in Georgia, have a lot of people working extremely hard. We got a great staff here at the department. We have great working relationships with the courts and across all branches of government. I'll just also mention on the forensic piece, we've already stood up 2 pilot programs for jail-based restoration services. We're providing clinical services in the jail, so people don't have to wait to come to a state hospital to receive competency treatment. We also are expanding our community-based restoration services. We've also expanded of who our evaluators are. We've contracted and worked and brought on professors from our local universities in different regions of the state who are doing forensic evaluations. We provided some training for those individuals. So we're excited to continue to lead in this area, and the work's not done, but with folks like Chief Justice Boggs and other leaders in our state, we're going to continue to improve the state here in Georgia.
Thank you so much, Commissioner Tanner. There is so much work underway through your agency, the department, and I just wanted to note that clearinghouse as an opportunity to continue the county-to-county sharing that has happened through this project. So it's a really neat way to institutionalize that local peer networking. All right, if I can turn it back west to Jamie and to Senator Ortiz-Pino, any concluding thoughts about how implementation is happening in New Mexico? And this will be my last question to the panelists before we open it up for questions.
Well, Hallie, the issue that's come up in connection with both states, I think, of shortage of manpower, of trained and skilled behavioral health manpower, is one that we're trying to address in the upcoming session. Our interim Legislative Health and Human Services Committee is proposing what we're calling a moonshot effort, a $100 million increase in funding for the schools of psychiatric nursing, psychology, counseling, social work, additional residencies at the university, all geared toward trying to expand the behavioral health workforce in the state, which is our biggest block right now. We've got lots of money from the oil and gas industry, but if we can't hire people, if we can't find people to work, we can't spend that money effectively. And so we need to get the pipeline filled with people who want to stay in the state, who want to get their training and serve people here. But in the year that just passed, we did take several of the recommendations and introduce them as legislative proposals. A couple of them passed. First, the Senate Bill 260 was one that addressed the need to clean up the language in our statutes that was so outdated and inappropriate in the courtrooms and in the treatment facilities. So that bill passed. We passed Senate Bill 425, which expanded the opportunities for medication-assisted treatment in our jails and prisons, and linked them to outpatient treatment through the opioid settlement money upon release. That was passed. It's slowly being implemented. We'll have a progress report later in the month on how it's going. It's just something we're going to have to stay on top of because it didn't happen overnight, obviously. And then finally, one that we introduced that didn't pass, that we want to keep coming back to, and that's an effort at better funding, a more secure funding stream for our alcohol and drug treatment programs and behavioral health programs generally. There was a change in the way we use the alcohol excise tax. In New Mexico, half of that money now has been used for the general fund. The proposal was to put it all to use in treating drug and alcohol problems. While it didn't pass this year, we think it has some good support, and hopefully it will pass, if not the coming year, and the year after that. And I'll turn it over to Jamie to deal with approaches that have been done for implementing some of these recommendations at the executive level.
Thank you, Senator. So here's where I think I would, my advice to other communities is to follow through and keep going. We did a very intentional strategic job with the legislative pieces and looking at policy through legislation. We need to keep that in the administrative policy work and through some of the executive departments. I think we went from a very open process that included the voice of local governments. And in some of these areas now it's kind of contracted again, and each of the state agencies are coming up with their own definitions, promulgating their own regulations without incorporating the voice of counties. So I think that's been an area where I look back and say, oh, we should have kept this thread going into the next, from the legislative policy work to the administrative policy work. That I think that yeah, just being more intentional about that would give us better opportunity, because again, we don't want some of these regulations to be created in a vacuum without input from local governments. So looking again to the future and just helping educate everyone, whether it's agency heads or elected officials, that we can look at both qualitative and quantitative data. You can talk to local providers. I've heard a lot of folks talk about some of the success with their programs includes working with peers, people who have been through the system with lived experience. So collecting data from folks who can say, been there, done that. And then also looking at the numbers of within each of the systems. So collecting both kinds of data and sharing that data widely, along with, don't reinvent the wheel. There are some best practices out there. So making sure that people who are in some of these decision-making or advocacy positions aren't just having a knee-jerk reaction to what they see in the headlines and coming up with, I'm going to find a solution for this because I know it's a problem, but really looking at the data and some of the promising practices. This is slightly off topic, but I wanted to address, it's not even within our state that we can learn. In New Mexico, we took some data that was gathered in Georgia. So Commissioner Tanner spoke about the crisis system that they are looking at. In New Mexico, we're looking at the Crisis Now model, and much of that data came from Georgia and from crisis work in Georgia. So there's something called the capacity calculator. And I think that was built with data that was validated in Georgia, and now it's helping us here in New Mexico. So just knowing that we're all addressing some of the same issues and resources do exist. You just have to know where to call to help us navigate that system. Thank you.
Jamie, thank you so much. I know that we're getting to the end of our time together. Andrea, I was just going to ask if you could please pull up the, I think it's slide 15 that has the summary of the policy recommendations. And then I think I'm going to take this question over to Chief Justice Boggs and Commissioner Tanner first. There have been a string of questions in the chat about different subpopulations, people with traumatic brain injury, people with developmental disabilities. And I was hoping to elevate that and just ask if you had any reaction. How did those different subpopulations, how are they addressed or not addressed in the scope of your work? And sort of next paragraph, also a question about conservatorship, involuntary treatment. So a couple of questions about different subpopulations, as well as to what extent the work you're doing moves over into the civil system.
I'd be happy to answer a couple of those. As far as the subpopulation, the developmental disability population, our department's also responsible for being the state authority in that area. And that's obviously a very challenging population, especially when it touches the criminal justice system. And we've not solved any of these problems completely, but we are under a settlement agreement, have been for a long time, with the Department of Justice around the DD population. And we're not able to readmit or admit anyone into one of our state hospitals that has a primary developmental disability diagnosis, which means that we're having to treat these individuals completely in the community. That makes it challenging. We have on average every day 24 individuals stuck in an emergency room because there's just no community placement, because they have a combination of behavior issues. to go along with their developmental disability. We're currently right now in the process. I was there yesterday over in Augusta. We're building out 2 4-bedroom homes that will be an intensive step down out of an ER for folks with DD that have intensive behavior issues. We're also building the state's first DD crisis facility down in central Georgia. It'll be 16 beds with a very robust outpatient center with telehealth services and complete integrated health care. It will provide complete care, whether it is dental, dermatology, anything that person needs. And we're going to use it as a training and learning facility. We're partnering with one of our university partners, medical schools and nursing schools, to rotate people in and out of that program. And then we're also in the process, we're going to be standing up 3 additional types of facilities to handle the whole gamut of the DD population here in Georgia. So we're making progress, but we're not there yet. On the area of civil commitment 1013s, we've taken a look at that, and we actually have a subcommittee, the Behavioral Health Reform and Innovation Commission, that Judge Briana, who's the Superior Court judge here, has chaired for a number of years. And from their work and working closely with Chief Justice Boggs, they stood up the AOT program, the outpatient treatment facility that's facilitated through the court process, typically probate court here in Georgia. And that is a non-voluntary program that they're able to have certain requirements on individuals. And that's early data has been extremely promising. We've had one of those programs stood up now for a year, and it has decreased dramatically the number of days that those people have spent in jail or in a hospital. So we're making progress in that area.
Great. Thank you so much, Commissioner. And I think we'll just go to our thank you slide. We want to be respectful of everybody's time. So first, thank you to all of our attendees for joining us and for the work that you do. We hope that you have found things in today's conversation that are useful and ideally inspiring to continue the work that you're doing. And now, huge thanks to our speakers for the work that they're doing and for spending the time with us to share what they've learned. Wishing you all well. We will have a final report and case studies about this project coming out at the end of the month. And you'll, as I said earlier, we'll have the recording of the website and the slides, the webinar and the slides available on our website in a couple of weeks. Thank you all so much again for joining us, and have a wonderful rest of your day. Thank you.